Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. Boy, do I have a treat for you all. We have Dr. Thomas Larkin with us today. Now, we've never met in person, Tom, but as I set off recording, I feel like we've been singing harmony for years because we've got the same message. So I feel like I've met someone with a common heart who really cares about patients, who wants to see people feeling better. Welcome, 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 Dr. Larkin.
Oh, thank you so much for this opportunity. We are kindred spirits. There's no question about that.
Well, Dr. Larkin graduated from the University of Creighton School of Dentistry in 1980. Of course, I was 1985. So we're right there in the same area. So, Tom, dental school, what'd you learn in dental school that you're still doing today?
Nothing.
Yay. I'm so glad to hear that.
I didn't learn anything.
Yeah, we were trained as carpenters, weren't we? Excellent.
Exactly. Molar mechanics is what I call it.
Molar mechanics. Yes, we can fix teeth. I joked, Tom, our daughter, when she was 6 years old in kindergarten, her teacher said they were talking about what their parents did, and she said, "Well, my mama is a laundry lady, and she fixes teeth." And so that is so accurate, so awesome. Accurate. So you had a conventional practice.
Yes, I practiced conventionally for 9 years. And then, like a lot of people experience, you just get overwhelmed with restorative, reactive care. And I was like, and I was in a smaller town with like one periodontist. And at that time, and you'll resonate with this. So you send people, like you're trained in dental school, to the periodontist if they have like 4mm pockets. And then they would have this awful surgical procedure called the gingivectomy, and the patient would come back. They would be very painful, very unhappy. I was like, I got to figure this out, otherwise, and of all places, Reader's Digest, there is this very controversial figure called Paul Keyes, who, he was rogue, and somehow, without an internet, I don't know how I made these connections, but I hunted him down, and he gave a small course in Washington, D.C. on anti-infective periodontal therapy. What a concept. This is an infection, right?
Yes.
And I came back and just did a complete pivot, put a microscope in my hygiene operatories, train the hygienist how to use a microscope, look at microbiome. Now, what's really important to know is that there are two phases to this. So at that time, I was doing it for the sake of periodontal disease and dental caries. I had no concept of oral systemic connection, right? So my patients got the benefit of that, and I didn't know it, and they didn't know it, right? So then I had this complete renaissance. Fast forward 2013, and now I'm living in Lexington, Kentucky, which is where I wanted to end up and to retire. And I see this conference about American Academy of Oral Systemic Health, and I go, and I'm like, oh my gosh, there's this massive connection between oral health, periodontal health. And I said, I got to get back in this conversation and to create courses to teach dentists, because none of us are taught this, right, at all. And that's kind of this latest phase of me training, giving live trainings on, pretty much focused in hygiene, right, on the technologies, and, just kind of goes from there. And right now, I always like to refer to myself as the Maytag repairman, just like, not super busy, but, busy enough. Now it's like an avalanche, right? Yeah.
Right. Well, I so respect that you're teaching dentists, because I know that's the toughest audience to convince that we don't know everything.
Right.
My area, Tom, is more to grassroots, to people. I have a course to help people know what to look for and what to do. So as you had this epiphany, I know part of that was the Bale Doneen program of heart attack and stroke prevention. And I know that one of your areas of expertise is heart attack and stroke prevention. I really want to talk about that. But I I had a similar experience in 2010. I got a flyer in the mail. I remember the moment I looked at it. It was a vascular inflammation class given by Dr. Bale and then Amy Doneen at that point before she got her doctorate. And they introduced oral DNA. And so, I ran to the course, couldn't wait. And that totally changed the
Yeah.
trajectory. And then that morphed into this awesome preceptorship in heart attack and stroke prevention. So
Right.
tell our
Yeah.
listeners about
So
that.
so the meeting that I went to in 2013, Dr. Bell was the keynote,
Yeah, he's
right?
a cardiologist for our listeners.
Preventive, he's created this Bale Doneen method. And the thing that I still to this very moment, can't get my arms around is that Dr. Doneen, Dr. Bale, Dr. Bax, who I use now, I've used a couple of different people doing the Bale Doneen method. They have a track record. Now, get your arms around this. 100% track record. No one's had a heart attack or stroke ever. And I'm like, why don't people know? Why is this not, this is like insane. So here was the deal. Dr. Bale gets in front of the room and he says, I have this 100% guarantee. And I'm like, oh, I was completely turned off. No one can do that, right? But I was also curious because of my family history. My father had bypass surgery, diabetes, cancer. He had everything, right? And so I'm approaching that age in my 50s and I'm like, what do I got to lose? So the first thing I did was I became a patient. I went to Nashville and became a patient of Dr. Bale's. And, when you're a new patient, he spends like all day with you. I mean, it was almost like all day. Then I did the preceptorship and then I said, okay, I'm staking my life on it. And now I have an 11-year track record. And in some of my courses that I give, I go through my labs. I just show my labs and I say, this is a reversible, manageable deal. But here's the really important part to me is that, and the reason why I really kind of singled him out as opposed to other functional medicine doctors is that he requires the participation of a dentist. And when I saw that, that's what I honed in on. Okay. So to become a patient, I have to bring a CT scan, a salivary test, and a sleep screening. Okay. And I was like, well, that's cool, right? It's a little bit, it's different, right? So I'm saying to dentists, and once again, that this is a niche play. It's 5% of dentists who are into this, soon to be 10, but it's not going to overwhelm dentistry. But I'm like, guys, listen to this. This is someone that says, I'm a Bale Doneen certified physician. I have to collaborate with you, right? I need this from you. So that was the opportunity. And I created a handbook. I created a course to teach this collaboration. And in fact, and we can talk about this later, but I've got an upcoming meeting in April where Dr. Bale is the keynote at my meeting. And not to be political, but there's a lot of there's a lot of changes in the wind around prevention. And I'm going to kind of create a blueprint around that so it was a little bit of a pivot for me because I'm generally teaching technical stuff like how to do a salivary test, how to do guided biofilm therapy, how to use a laser. And now I'm stepping back and I'm bringing a group of people and saying, okay, let's create a blueprint so that when Health and Human Services says, hey, preventive people out there, step forward and show me what you're doing because we have to change our broken system. I want to have people kind of teed up for that.
You are changing the trajectory of the health because this is where it all begins. You commented on my TED Talk, The Forgotten Orifice, and I'm shocked, and I know you are too, Tom, about how this is not everywhere. I mean,
no.
like you said, 5% and maybe 10. It's just crazy that it's not 90%. Because when you see your first person, when you see their C-reactive protein plummet, or you see that weird rash on their leg go away, or you see them start pooping, or you see their mental abilities improve, I mean, isn't it exciting?
Well, it is, but it always comes down to money. Okay, so in part of one of my presentations, I always go back to Charles Mayo, 1915. He and his brother founded the Mayo Clinic, and one of his famous quotations is, "The next great advancements in prevention, 1915, will be made by the dentist. The question is, will they do it?" Well, the answer in 1915 was no. The answer in 2025 is almost no. And the reason is the same. The reason in 1915 was technology. So what was new? And from my understanding, it was local anesthetics and radiographs. Okay.
Right.
Dentists were distracted by technology. Dentists by nature are engineers. Most of us are engineers. We like to build things, use our hands.
Yeah.
And so they were distracted. So in 1915, Charles Mayo he was so far ahead of his time. And so, and there's been several people through history that have pleaded with dentists, and the dentists have ignored them. Well, what do we have today? We have the digital workflow. I mean, the amount of money that a dentist can make today in a day with a digital workflow with implants and milling crowns and stuff is insane. You can't make that in prevention. So it's always, unfortunately, coming down to the dollar.
Oh, that is so astute, Tom. It just gives me chills. But you can't buy the kind of satisfaction
No,
that you and I get to
no,
experience,
right.
and the relationships that are forged through this, through seeing
Yes,
people get better, through seeing people get pregnant
yes,
that have tried
no,
for 10 years. Well, and I love your quote by Dr. Mayo. I did wellness coaching training there, and there's a big area inscripted in the granite that where he also said, a sick man is not like a wagon to be taken apart and repaired in pieces, but he must be treated as a whole.
yeah, wow,
And the mouth is like the first portal,
yes,
and with the Bale Doneen program that you're so involved in, getting physicians to believe that
right.
is the biggest challenge.
Yeah. And so people, and here's the good news, people find me, and I'm kind of new to podcasting and doing podcasting on my own now because I really feel, empowered to do this. But the people that find me, I'll just get somebody that'll show up on my calendar. They're all very purpose driven. They're all very authentic. Okay. So one of the things I
Right.
see
Right.
today, I don't want to call it epidemic because it's always been a problem, is burnout. And so when I went to the A4M meeting in December, which was
Mhm.
really a seminal moment for me, there was somebody who was presenting, the physicians are making this shift earlier than dentists. And one of the comments was desperation versus hope. Okay. The traditional reactive model, when we go in and manage disease and see 60, 70 patients a day, primary care, whatever, it's overwhelming. It's depressing. No, it's no wonder physicians are depressed, suicidal, the whole thing. The same thing with dentistry. It's like what happened to me, kind of in a mini fashion. It's like, is this all there is? It's just like drilling out holes, and can anything be done to stop this, right? So it's a real mental health issue too, and that's something that you are doing such a lovely job of addressing everything in a more holistic manner. So this goes back to the happiness question. Okay, so what does it mean to be happy? I got a boatload of money. I'm doing all on X. I produced 200 grand last week, but are you happy? Are you happy? Right? And so people are starting to challenge themselves, and I see a distressing number of people quitting dentistry, and it's always about 40, about 15 years
Mhm.
in, hygienist quitting. And so that's how people are finding me. I said, there's a different way. I call it the slow down. Slow down. Slow down. Let's start looking at people holistically. Like one of my proudest things that I've done is so I'm in Lexington, Kentucky, and since I left the university, I've done 6 startups or acquisitions with students that I taught or students that I knew, right? It wasn't that I was wanting to have a transition business, and so one of them is a holistic practice. And her name is Dr. Rachel Riley, and she's in Midway, Kentucky. We have a practice here that's I think she's been in practice 5 years, and now it's a wait list. She doesn't take new patients, right? That's the kind of, people will beat a path to your door if you're doing a 2.5 hour new exam, getting to know them as a person, getting to know all of their issues and all their problems, and taking stellar care of them, right? This is what I'm trying to tell. She's doing fine, right? And you can't get in to see her. And then what happens when you do that? It's kind of unintended consequence. Now people want you more.
If you're enjoying this episode, please subscribe and share with someone who wants more vitality. Please leave a review, subscribe, and like this episode. It helps to spread the word. Thank you.
No, that's super interesting. I'm really glad you brought up the whole point of physicians catching on. It's so interesting, Tom. I started going to A4M probably in 2015
Nice.
and, did their fellowship and then their master's actually to protect my license initially, just when you start looking outside the mouth. But physicians in, say, 2015 were kind of like, well, what are you doing here, Debbie?
Yeah.
And then now, like you were at the December meeting, I wish I'd known we could have had coffee. People are like, "Oh, you're a dentist, and you're here. Oh, let me tell you about this."
Yeah.
Dr. Nathan Bryan was on the podcast talking about nitric oxide. You'll have to get him on your podcast.
Yeah. Yeah.
It was fascinating, and he is so
Yeah.
supportive of everything we're doing. He will be so impressed
Yeah.
with what you're doing, Tom.
Yeah.
And the happiness issue is huge.
Yes.
People are healthier when they're not living in that state of constant stress, constant frustration, constant, unforgiveness, disappointment. I love to quote Bronnie Ware. She was this hospice nurse, this Australian hospice nurse who kind of collected deathbed comments. And nowhere was, the top 5 comments all were about, I wish I'd spent more time with people that I cared about. I wish I'd pursued what I really loved. I wish I had, spent more time just enjoying my flower garden, things like that. Nothing was money.
Right. Right. Yeah. Yeah. And unfortunately, I've kind of watched social media evolve, and the fear of missing out, this concept of comparison is so unhealthy for especially for young people, and I've noticed it really early on. And I have like private Facebook groups. I understand the purpose of it and everything, but on balance, when you're constantly looking at possessions, material possessions that other people have, or what they perceive to have accomplished, it's brutal. I mean, I am so glad that I didn't have that measuring stick at that point in my career where I was like, knowing what other people are doing. I was kind of stick in my lane, and I'm pretty humble and pretty modest about accomplishments, right? And now it's just open season, and it's not healthy, and that because you're coaching people on happiness and health, right?
Right, right. No, it's not healthy. Well, and with all of the changes through COVID the last 5 years, so many young people are so much sicker. A recent study I read, Tom, talked about a 30% increase in heart attack and stroke in young people, 25 to
Yeah.
44. So
Yeah.
tell us about what you see related to the oral microbiome and this infection that is so often ignored in the mouth.
Well, it's just essentially it's just it's a knowledge vacuum. Okay. So let me kind of divert just a little bit. So one of my newest things, and so Dr. Craig Bax is my current Bale Doneen guy, and we talk on a regular basis. I did a podcast with him a couple of weeks ago, and we started talking about glucose monitors, and I was aware of it. So when we talk about educating patients, and I always, as I refer to Dr. Mayo, I always go back in history to look at, nothing is new. Okay. The health belief model was in the 1950s. A group of psychologists got together and said, how do we get patients to choose preventive care, choose better care? That's 1950. Where are we at today? We're not any better, and you talk about, young people in particular. So we need new approaches. Okay. And so Craig was telling me about this glucose monitor that doesn't need a prescription. It's and you can buy it one at a time. You don't have to get in a monthly deal. So I get this thing last month, and it was the nudge that I personally needed. Okay. So I get one for my wife, and now we're kind of competing with each other as far as who can maintain their sugar in range. And I'm like, this is so freaking powerful. This is so powerful because you'll get a text alert when you get a glucose spike. So if insulin resistance is the most underlying factor on everything, it's the driver for everything. Here's a tool, here's a technology, here is whatever, right? And so these are the things that we need to be embracing. So you'll like this, what happened to me yesterday. Friday, I saw just something in passing about our state legislature was in session. I don't pay attention to politics. That's not a good use of time. But they wanted to have a task force for MAHA. And I was like, oh, that's interesting. Because if politically prevention is going to move to the forefront, we need to kind of just lay down our political views or how we react to different things and say, okay, well, this is good. So this is Friday. I wrote down the names of the senators. I overnighted a package of all my stuff, what I'm doing, long letter, whatever. Yesterday at noon, I'm at the gym, I'm on the treadmill, and I see, I got a call, and I see that was from the state capitol. I was like, oh, I better take this. So I get up to there, and it was the senator. And she said, hey, this thing hasn't passed. It's moving through whatever. And she thought it was going to pass. But, what you're doing is really important. I was like, yeah, I need to be on this task force. And I am 1,000% apolitical. But this thing that I was just telling you about, the glucose monitoring, whatever, what I want them to know, and I'm old enough now to speak the truth and not really care what people think. Right. I'm going to say, please don't fill this task force full of university people. It's like what we're finding out about the government with antiquated, doing the same thing over and over again. There's millions of dollars been spent on quote unquote prevention in this state, but we need to innovate. Okay, so the future in what Dr. Bax calls nudges. We need little nudges. So what I needed personally was the glucose monitor. That was just, I needed accountability. Okay. And that was what it was for me. And it's important. And so everybody has that. So we need to rebuild our healthcare system around innovation, around wearables, around trackables, around accountability partners. And because it's not in the traditional sense, dental students doing sealant trips is a freaking waste of time. All right. It feels good. All right. But you're not, they don't even know what the oral microbiome is. What are they sealing up? What are they sealing in?
No, I applaud you. I am just, my feet are dancing hearing about that you might be on that task force because you've had boots on the ground seeing what really happens. And I think, it's so wonderful that you and your wife are wearing those glucose monitors because you already know what insulin resistance does. You already know what high glucose does. That's what people have to know, though. They have to know that it's going to steal their life. They have to know it's going to steal their mobility. It's going to steal their brain power. It's going to steal their money. And I think that's part of our mission, Tom, is to just let people know this matters for what matters to you.
Yes, absolutely. That's a great saying. Yeah.
But we just, like, people will say, I was at a wedding shower and I never say anything outside of, the podcast or clinic, but someone, there was this beautiful array of food, 4 blue cakes and, all that. And someone said, well, there's nothing in there you'll eat because you're healthy. And I didn't say anything. I would never say anything. I said, oh, there's plenty in there that I'll enjoy. I mean, there was plenty of good food, but the problem is, Tom, we know what it does.
Right.
That's the thing. And so if people can know, okay, what's important in my life, and my oral microbiome is directing that. I want to go to someone who has a dentist who does Dr. Larkin's protocol, who gets it. I want to go to a dentist who's not going to just want to get the drill out all the time, but who wants to proactively prevent problems. So you're training dentist, and people can find a dentist who has your protocol. Like tell about your protocol, and then kind of what
basically
that looks like.
What I call it is oral microbiome optimization. Okay, and so the little moniker that I've trademarked is test, teach, treat, repeat. So the first thing is testing, and I teach the microscope chair side and salivary testing, and that's been around a while, but it's really getting traction right now. And so we talk about that and how to utilize it. The reason why I've always leaned on the microscope so heavily is because I don't have to charge for it. It's a screening, it's a 25-cent test. It's also extremely educational, right? As far as being diagnostic, Yeah, it's a risk assessment tool. You either have a healthy microbiome or you're way out of whack, right? And what you see with the naked eye is not what's going on. There are many cases where I would look at someone and say, you look okay, and then you see the slide and you go, oh my gosh, you got stuff going on. Okay. So that's the test part. And then the teaching part is really, that's the missing part, is that in all of medicine, is that how do we get patients to move off the dime and to own their health, okay? Own the responsibility. Well, right now, we have a crushing financial responsibility to do that. That's the motivation for most people now. Healthcare premiums are absolutely obscene. So let me tell you about a new thought that I had yesterday, because I'm always thinking, you can tell. I'm thinking about this glucose monitor, and I'm looking at, I'm 99% in range over 2 weeks. Okay. And that takes a little discipline. It has broken some of my habits. When I would go to pick something up, I don't pick it up now because I know the accountability. Okay. Tracking devices in automobiles. If you put a tracking device in your automobile, your your car insurance will give you a 30% discount. 30%. Why? They see every turn, every speeding, every whatever, and then they rate you accordingly. And they say, you're low risk, because you drive, you drive safely, right? Why not take this data and give me a 30% reduction in my healthcare premiums because I'm responsible? We can't, as a society, punish people for bad behavior. If you want to smoke, knock yourself out. This is, you have the right to do that. Okay. So we can't punish people, but we need to reward people who are acting responsibly, because I'm paying for a ton of other people's problems. I'm paying a premium for their problems, right? And that's not correct. So in the course of refiguring healthcare, that was something I said, that's a no-brainer. That's an integration of saying I upload my stats and I earn a 30-40% discount because I worked my ass off because I had some discipline. This whole thing of insulin resistance and obesity, we're being convinced that there's an Ozempic deficiency. Okay, $1,000 to $1,500 a month for this frickin' child. It's the biggest frickin' scam I've ever seen, ever.
Well, and I'm quite concerned, Tom, about the tsunami coming of muscle loss. About 30% of the weight is actually muscle loss. Yep. And so, that's going to just feed forward to all these other problems. Yep. So I like your idea of rewarding people who have self-discipline. That's in every other area of life, right?
Exactly. Exactly. So this gets back to the money part. It gets back to the part that is on everyone's mind, is healthcare premiums. My premiums went up 20% this year. That's not sustainable. Our system is not sustainable. People that know anything about money, that knows that our healthcare system is not sustainable over time. It's one of many problems, but I think it's the number one problem. So then you go to A4M and you see 7,000 people who kind of get it and are getting in front of this. Unfortunately, dentistry is very poorly represented. I mean, I ran into like 3 dentists there, right? Mm-hmm. And I was very impressed with that meeting. And that meeting really has kind of pushed me forward a little bit, because I said, I need to get out there and talk more about this other side of dentistry.
No, that's exactly right. For our listeners, A4M is the American Academy of Anti-Aging Medicine. And I started their fellowship, back in, 2015, 2016, based on a local functional medicine physician. We had a case, Tom. A woman, she sent a patient to me that had a C-reactive protein crazy high, like off the chart. And literally all we did in the office was SRP with a laser. And this was 2013. And we did salivary diagnostics. But she didn't really have high levels of those really bad bacteria that we would think would cause that. Right. Nevertheless, in 60 days, the physician retested this woman. Her C-reactive protein had dropped from almost 20 to 2.9 without antibiotics, simply with oral microbiome management, nothing fancy.
Right.
But what was so astounding is that also her blood lipids improved, her blood glucose
Sure.
improved,
Yeah.
everything on her panel moved.
Yeah.
So we had that biomarker of inflammation, which is what
Right.
C-reactive protein is for our listeners, but everything moved, and it was so simple, and it was relatively so inexpensive. So
Right.
at that point I knew I've got to get some more education here, and A4M is really great. It's for our listeners, it's global.
Yeah.
And so you meet people from all over the world. It is curious people like Dr. Larkin, like me, people that know we don't know everything and
Right.
that we have so much more we want to learn. I mean, that's one of the things I respect about you, Tom, is that you're continuing to learn.
Oh
I
yeah.
don't think you learned it all in dental school.
No. Oh gosh, no. I learned so much. I learned something every day. It's funny you mentioned that meeting because when it was recommended, that meeting was recommended to me, and I was looking at the website and I saw the anti-aging, and I had a little bit of concern that it might be kind of on the med spa side, right? Meaning,
Hmm.
Botox and cosmetics
Right,
and stuff.
right.
And because I don't think that name really does it justice because it wasn't that at all. It wasn't at all, right?
Right. And I 100% agree, Tom. I don't like the whole anti-aging term. I mean, if you look at what's going to hit on, YouTube, it's going to be anti-aging, but it's an incorrect term.
Right.
We are designed to age, and we want to slow it. We want to age later, but it's not anti-aging. And certainly all the things like, Botox and fillers and all that, that's not anti-aging.
Right.
Even if you looked at that, doesn't
Right.
slow aging. That doesn't
Yeah.
slow aging a bit. And
Right.
and of course, that's an area that I think is coming into dentistry and potentially blinding people from what really matters
Yeah.
with the oral microbiome.
Yeah. So let me tell you something else that's brand new to me, and I've just learned about it that I'm super excited about, and that's biorestoratives. And I saw a webinar last month, and it was on AI and prevention. So if it hadn't had the word prevention, I may have skipped it. So I attend this thing, and so there's a couple of new softwares for reading radiographs with AI. And so, yeah, I need to kind of take a look at this and kind of see. And the dentist that was presenting, it was really compelling, and I got really, really excited. So what AI is going to do, especially in the area of radiographs, one of the biggest problems in dentistry always has been when you have multiple providers, either multiple providers within a practice, or you go to a dentist and then you get a second opinion, is you're going to get two different treatment plans. I mean, that's just, if you go to 10 guys, you're going to get 10 treatment plans.
Right. Right.
And so what AI has the capability of doing is to kind of objectifying that just a little bit. Okay. And I'm sure there's, I'm sure it's not perfect. So anyway, this person puts up some bite wings with an incipient initial lesion. So that's an area of decalcification that could become a cavity. Okay. And then once you have a cavity, then you start a process that's called filling, then crown, then root canal, then implant.
Then
right?
extraction.
Yeah, then extraction. Then it's a process, right? And so you have a dentist who is conservative or a dentist who is aggressive. And aggressive is not the right word, but so someone say, oh, my favorite word in the world, we're going to put a watch on that. And it's like, what the hell are you watching? Okay, well, you watch me get sicker? You want to watch cancer go from stage 1 to stage 4? We're going to watch it. Okay. So anyway, so this person shows up and the AI marks it. And then there's 2 new biorestoratives. And this is actually going in and rebuilding the crystals and rebuilding the enamel. And then the bite wings are taken in 6 months and there's nothing there. This tooth is completely healed. Now, this is legitimate. Most of the stuff that are anti-cavities, what we do is we stop the disease process. Dental decay is an infection. It's a bacterial infection. So most things in the past from fluoride or whatever has been to kind of arrest the progress. But it's the first time that I had seen legitimate evidence of just complete regenerative, right? And I was like, okay, this is really cool because now this is the dentist that I want to go to where my x-rays go through AI and they see the earliest possible lesion and they say, hey, doc, I'm going to just paint this on here and we're going to regrow those crystals your tooth is good to go. And I'm like, okay, now this is that technology, this movement that I'm seeing that really kind of has me, pretty excited. So that's on the decay side. So I tell the story of my relationship with Paul Kais. Paul lived to almost 100. His wife lived to 101. So much for baking soda and hydrogen peroxide. Okay. And I kept in contact with him. The last email that he sent to me, he was 99. And it was just one line. And I have it in my presentation. It says, Tom, it's hard to get people to accept new ideas. Okay. And I said, so that's the perspective of someone who's been on this planet for 100 years. I was like, but anyway, getting back to his goal in the 60s and 70s, he had a mission statement was to eradicate dental decay. And he had a foundation. He worked with the Peace Corps. He had the right mission statement, but he didn't have the technology. He invented fluoride trays in 1962. He brought a couple of different concoctions of sodium fluoride to dentistry, but once again, wrong tools. So I'm looking at biorestorative and I'm saying, wow, would Paul like this, right? And then I'm looking at one of the technologies of someone in my meeting is a prebiotic. Her name is Emily Stein, Stanford trained microbiologist. And it's really innovative. It is a non-pharmaceutical, but it alters the oral microbiome, selectively starving pathogens. Okay. And so both of these companies are going to be at my meeting, and I'm going to tell people, I was like, I have two people in this room that could fulfill Paul's vision of 60 years ago. We can regenerate tooth material. We can reverse things. We can stabilize. I use the word manage. It's one thing that I've learned about oral microbiomes are dynamic. They can't be cured, but they can be managed. Okay. They change. And that's why they require, diligent home care, and they require diligent professional care. You're never just good to go.
Right.
And that's one of the driving factors. And we talk, and I'm just going to touch on this if you're okay with time. The dental implant thing. I'm very concerned about it. The number of dental implants, the number of placements is increasing like this. The number of failures is increasing like this. Why? Patients are under the misconception, and the dentists are kind of partially responsible for this. Oh, I have a dental implant. It's titanium, zirconium, whatever the flavor, and I'm good to go. All right, I'm just good to go. And they don't come back. And they're getting gum disease. And actually, there are some physiologic factors around the anatomy of them. When you have gum disease on an implant, it's actually worse than with a real tooth. They're not really attached in the same manner. And people are having failures. But the only problem is the price tag. These failures are emerging in a huge, and then what do? You graft and do it again? So this whole concept of managing oral microbiome with a natural dentition and with an implant restored dentition is the emerging conversation that I see for the next 5 years. And it will be driven around liability issues.
Oh, goodness. That's interesting, because when things are driven around liability issues, people listen a lot more than they do but that's a reactive side, right? That's not a proactive side.
That's why I'm not the Maytag repairman anymore.
Oh, that is so good. And I totally agree. Even with a patient I saw recently who had a deep cleaning periodontal therapy in 5 years ago and hasn't been to the dentist since. Yeah. And sort of thought, okay, well, I got that done. Now I'm finished. And so, you try to be very sensitive to someone's level of knowledge and never shame anybody. But I knew that he was a gardener. So it's like, well, now if you had somebody come over and plant a beautiful garden, would you ever think you needed to weed it? And so that's kind of exactly what you're talking about. Yeah. They think, oh, I've got this, even if it's a knee implant, even if it's, right, any of that. We're seeing more problems with these because part of that, Tom, don't you think it's just metabolic health being, less than it was 10 years ago, even less, 20 years ago, keep going. So you think about, right, insulin spikes, that all affects, right, everything.
Right. Yeah, because I love the term tend. So Dr. Stein used it in her presentation, and she was talking about tending to the oral microbiome. I said, you know what? The only reference to that word that I've ever known is tending to your garden. Okay. And so that's that whole concept of your microbiome is like a garden. You need to tend to it. So that's kind of funny. But getting back to the insulin thing and the glucose. So I have a slide in my training, and one of the things, and I'm always looking for ways to change the conversation for hygienists. And it's a graph of, the traditional spikes of pH in the mouth when you drink an acidic soft drink, so it's spike, spike, spike. Person drinks Mountain Dew, sips it all day, spike, spike, spike. Well, right underneath it, I have the glucose graph, and it's identical, and the spike is identical the same. And so what I'm teaching the hygienist is that I want you to look at this different. This is in parallel, right? So when you have a challenge orally with the microbiome and pH, you've just challenged your pancreas. And basically what happens with the pancreas is that you just challenge, fatigue, fatigue, fatigue. And then the pancreas says, 30 years old, hey, I'm out of here, right? And that's why I really think central to this is the management of that glucose level, both orally. So what happens if I show you a 99% in range glucose monitor for 2 weeks? I know one thing, I had no challenges, I had no pH challenges in my oral microbiome. How about that? Wow, that's a concept.
That's an incredible concept because that translates also to better memory, better sleep,
Yeah.
Every area that really matters to people for their relationships. Well, and I appreciate you talking about the word tend, because you just think about anything in your life that's important, your marriage, your finances, your, on down the line, you have to tend it.
Yeah.
And so we can't think that our health is any different or our oral microbiome is any different.
Yeah. Well, the self-empowerment, the movement of self-empowerment. So what the A4M folks have figured out, and I tell dentists, there are more patients looking for this type of dentist than there are dentists trained. Okay, there isn't any question about it. This self-empowerment is rooted in finance, motivation, learn how to take care of yourself. Because once you use your $2,000 a month insurance with your $15,000 deductible, you're still on the hook for 15 grand. Okay. What a concept there, right? So self-empowerment, people going online, doing testing themselves. There's a pretty significant amount of testing you can do, both oral microbiome and blood tests on your own without a script, right? And so that's a trend. That's a trend people want, just like everything else. They want to do things, they want to become self-empowered. So this model that I'm talking about, this blueprint, this whatever's in progress, a lot of it should be based on self-empowerment.
Well, and from what I see from your program, it's fantastic, folks. You're attracting dentists who are curious and who are humble, who are not afraid of patients asking questions, who don't shame people for saying, what about this, or I don't want this, or here's some research I found. Would you look at this, doctor? That's huge.
Yeah, no, it's important. So one of the historic figures, another person that I pay a lot of homage to, is Bob Barkley from back in the 60s. And he basically wrote the textbook on preventive dentistry, and he had a huge following. It was American Society of Preventive Dentistry, and Bob was killed in a plane crash kind of at the peak of his career, and his movement ended almost immediately. But he's credited with the term co-diagnosis. Okay, so when you look at his readings and stuff, when a patient comes in, and I teach this in my course, that it is collection of information, and so the way that I explain it is that it's like, if you're my patient and you're in front of me, I'm not talking down to you or directly to you about your condition. I'm sitting next to you, okay, and we're looking at and we're learning together about what your condition is and what we can do about it. So I'm in alignment with you, and I'm partnered with you, right? And this gets into the psychology of how we present things. It's not like talking down. It's like you're talking about you have this. No, we're sitting side by side, in front of a computer monitor or whatever, looking at the data that's collected. we're looking objectively, and I'm your friend and I'm your ally, and you have this going on, and let's figure out what we can do about it. That's a whole different approach.
It is absolutely a whole different approach. I look at it as you can be the guide or you can be the hero. And I want to be the guide for my patients. And I want them to be the hero of their own health. Exactly what you're saying. It's just huge. So for our listeners, how can they go to your website, find doctors you have trained? Because there is a shortage of people like us. I didn't know it was even 10%, Tom, but I'm excited that it's increasing.
I don't think it's 10 yet, but I know that I think that's kind of projected. Yeah, I would be happy to share information that I don't have a director yet. I really kind of need to have that. That's been on my to-do list, is to kind of create a directory. There needs to be a directory for all of these biological dentists, and So I'm pretty easy to find. My email is tom@tomlarkin.com. My main website is tomlarkin.com, and that will lead you to other things on tomlarkin.com. So,
and tell us about your podcast.
Yeah. So my podcast, which I just started and I'm just loving it, it's called Oral Systemic Connections. And so what it is me interviewing these people that are in my world, like yourself, because I'm going to have you on it at some point, and really get into that thing of who are the people behind this, right? This authenticity, these purpose-driven people. So what I'm looking for, I knew it all along, but it's kind of there's a common trait, right, about people that just kind of end up in my world. And so I want to start interviewing and documenting and just having the opportunity, like with your audience, I think I've got a lot to bring to the table. And, I have a very unique thing that's just kind of happened around me. It hasn't been intentional at all.
That's the truth, Tom. This has not been intentional for me either. It was just one more thing. Even when I got the call for the TED Talk, I thought it was a joke, because I'm always playing a joke on somebody. So I told my husband, I said, somebody's, punking me, telling me they want me to do a TED Talk. And he's like, well, maybe you should actually call them back, but things just happen. You don't have a grand plan, but we know it matters, right? I mean, we care about people. We got into dentistry to help people feel better. And so we're getting to do that. And I just applaud you for actually having an oral systemic podcast. I mean, you're unusual to be oral systemic on my podcast. This is all about vitality, and oral systemic is really upstream. I mean, my course is called Upstream Gut Health because it's upstream. And so I'm excited about your podcast, and I want my listeners to find you and harness all of the experts that you're going to be having on that platform. So thank you so much for being part of Vitality Made Simple, Tom.
Absolutely. It's been a pleasure.
Well, and thank you, listeners. I'm sort of shy about social media. I'm trying to get out there, but it's because of you that we're now in 136 countries and I think over 5,000 cities. And so thank you. Keep sharing. This is information that can absolutely change the health trajectory of people. It can help them enjoy better relationships. And life is all about relationships. Blessings until next time.
Thanks for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieozment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.